It's very straightforward. I think patients need to be given the appropriate information for their circumstance, and then they need to make an informed decision about what they'd like to do. We do frequently get the question, what would you do for your own family member? But that's really irrelevant for each individual patient. I personally give patients what I think are the reasonable options for their scenario, which is individualized to them. And then they're free to choose among those options what they'd like to do, and then we proceed from there. A lot of it is education, just explaining what options they have, what are the long-term prognoses.
What are the main reasons women would need to undergo a hysterectomy?
Most common reasons for hysterectomy include abnormal bleeding and fibroids, actually. But of course, in my world, pelvic organ prolapse, meaning that the uterus and cervix are kind of sliding down in the vagina, is also a major reason for hysterectomy. And those three kind of round out the most common reasons outside of cancer reasons. And the symptoms can vary from I just have heavy periods to I have an enlarged uterus or I have heavy periods to maybe the uterus and cervix are falling out or they have all three. So there's a spectrum of disease, but usually one of those three things is the dominant thing.